Good evening, Jim.
Hello, how are you?
I'm good.
All right.
What are you doing there?
I don't
We're
know.
already wrecking our table here.
I guess so.
Well, I'm Doug. It's good to meet you, and I look forward to working with you.
Thank you.
I was going to let you know that, I've looked at the survey that you helped fill out and everything, and it's pretty clear that you have a generalized anxiety.
Mm-hmm.
Do you know what that's all about?
You mean, why am I anxious?
Yeah.
Yeah, I've worked at this company for a few years, and I felt like things were just going along great. I mean, I felt like my boss really liked me, and everything was lining up exactly like I wanted it to, and looking forward to another bonus this year and maybe a promotion, and then things just went bad.
Right. So when you have these anxious moments, what does that feel like to you? What happens to you?
Oh gosh, I mean, I feel like my heart is like trying to pound out of my chest, and I just get these thoughts going through my head. It feels like they're just totally out of control, and I just get so worried.
Right. Well, we're going to work on that, and I think we can help you out on those kind of things. When you have those moments, can you kind of specify or identify the thoughts that are going through your head at that time?
Yeah, I just feel like my boss doesn't like me. I don't know what happened. I mean, things were going along really good, and then, we had this report that I had due that was an important report, and he came back and he showed me some places where I had, I made some mistakes.
Sure. Well, that happens to a lot of people, and people react differently to those kind of things, and we're going to take a look at that. I'm going to go back and explain a little bit what I think the correct approach is going to be in working with you. And this is a collaborative approach. It's not me telling you what to do. It's not me saying, okay, Jim, here's all you need to do. We're going to figure that out together, because there's probably some thoughts going on in your head that you're telling yourself that's maybe affecting you in a not so good way, increasing your anxiety and that kind of thing. And what we're going to be doing here is we're going to be using a cognitive behavioral therapy.
Mm-hmm.
I'm going to tell you really quick what that is. It's a form of treatment that focuses on examining the relationships between thoughts, feelings, and behaviors. And there is certainly a relationship between all those three, and I think you'll determine that when we get to working together.
Okay.
By exploring patterns of thinking that lead to self-destructive actions and the beliefs that direct these thoughts, people with mental illnesses can modify their patterns of thinking to improve coping. Cognitive behavioral therapy is a type of psychotherapy that is different from traditional psychodynamic psychotherapy in that the therapist and the patient will actively work together, like I just said, to help the patient recover from the mental illness. So that's the general take. And don't look at yourself as you have a mental illness. It's more like a condition, that kind of thing. I think that's a little harsh.
Okay.
I'm going to show you something here that is really kind of the foundation of cognitive behavioral therapy, and it's called the cognitive triangle.
All right.
This is something that explains that your thoughts, behaviors, and emotions are all connected. Usually, thoughts that you have, maybe about a situation or about yourself, can lead to behaviors and emotions that may not be in your best interest. And by the same token, you might have a behavior that leads to a thought that's also kind of destructive to you. So we're going to be taking a look at that and seeing how those connections are affecting your behavior and your anxiety. Okay?
All right.
All right. So I'm going to kind of explain a little bit, and every meeting that we have will have an agenda, and you will help determine that too. It's not just going to be me. You're going to be able to tell me about some of the issues or problems that you're having, maybe from week to week, and then we can address those kind of things. But we, of course, have talked about that you have a general anxiety disorder, which is very common, of course. We live in a very complex world, and there's a lot of people that, of course, do have anxiety.
Yeah,
and
I've been anxious for probably my whole life.
Right. And a lot of people have to seek treatment for that.
Right.
It could be psychotherapy, it could be medication, or it could be a combination of those things. So, how are you feeling right now?
A little nervous.
Are you?
Yeah.
Just because this is kind of new to you?
I'm not sure what to expect.
Yeah, that's very normal. But on your level of anxiety, like what you have experienced on a scale of like 1 to 10, 10 being the most anxious you've ever felt, where are you right now, probably?
Well, I'm anxious because you know, I don't know what to expect here, and I'm really anxious about work right now. Maybe a 7.
Right. So one of the things we are going to do every week is talk about goals. Okay. What you want to achieve on a long-term basis, maybe what you want to achieve on a short-term basis. And so I think in some ways, one of the things we ought to be talking about in the way of goals is taking a look at your work situation right now, some of the things that have happened, and maybe talk about some ways that you can handle those things better.
Okay.
And it may involve going back to a long way to determine maybe what kind of thoughts that you're used to having within yourself, things that you might be telling yourself that might be on a negative basis. We'll have to look at that. It may not be the case, but in general, people that are suffering from some sort of anxiety, their inner thoughts may not be a positive thing. And these are called automatic thoughts. And we'll look at automatic thoughts because they can be very destructive if they're negative thoughts. These are thoughts that you don't really intend to have, but they just kind of come into your head. And just like we said, on the cognitive triangle, you've got thoughts that it can lead to behaviors and emotions that you may not like, or it may be make things more difficult for you there. So we're going to every week, we're going to talk about, you will talk about some of the problems that you're having, and we'll kind of narrow down to maybe 1, possibly 2 that we'll work on every week, that hopefully at the end of that, you'll start feeling some relief and maybe have a strategy for dealing with that a little bit better. Does that sound good?
Yeah, that'd be awesome.
Right. Another thing we're going to do every week is I'm going to give you homework, and it's not homework that, well, sorry. It's not homework in the sense of school, but this kind of work is not just a once a week kind of thing. It's going to take a commitment, and I think you'll see that if we have some projects for you to work on in between our sessions, that it's going to be extremely helpful.
All right.
Okay? So one of the things that I'm going to ask you to do between now and next time is take out a little notebook, or maybe you might be able to use your smartphone or something like that, but I want you to be aware of the times that you're really anxious. Let's just say at that level, like any time from an 8 to a 10, like we were talking about in terms of degree. When you get to that level of anxiety, I would like for you to make a record of that. I would like for you to say where you were, what the situation was, and if you can, what thoughts are going through your head at that time, and trying to articulate that. Now, that may be difficult in the beginning, but I think I can help you identify what some of those thoughts are, so it'll be a little bit easier. But this is going to be a real key part of our therapy here, to identify those thoughts. And then what we're going to do, you may say something like, well, I'm just no good at work. I'm incompetent. I'm not putting words in your mouth. But if you were to say something along that line, we need to look at that, because you may assume some of those thoughts are true, and a lot of times they're not, or at least they're not true to the extent that you think they are.
Okay.
Does that make sense?
Yeah.
What we're going to do is we will look at, if we identify an automatic thought like that, we're going to kind of shine some light on it and say, is this really true? I mean, is it an all or nothing thing? And that's very typical of a lot of people who have anxiety. It's kind of an all or nothing thing. If they don't perform to someone else's expectations or their own. They kind of throw the baby out with the bathwater and say, I'm just no good.
Okay.
And those can be very dangerous and very self-defeating. So we're going to look at those kind of things. Does that sound like we're kind of in the ballpark there, that you might, those types of thoughts might be holding you back a little bit?
Well, I don't know. I mean, I guess it's worth looking at.
Yeah. Yeah, I do too. And I think you're going to start seeing some benefits from this. And again, I really encourage you to express what's on your mind, things that you want to work on. The agenda really comes from you. I'm here to help you maybe see some things that you're not seeing yourself. And the whole goal is for you to start feeling better, right?
Right.
Feeling some relief, because I'm sure that when you get into those anxious moments, it's not very much fun.
No, it's not.
Yeah. Do you have any questions for me at this point?
Uh-uh.
I'm going to make sure that we covered everything that I wanted to. Another thing I wanted to tell you is that we'll be dealing with some ways that you can deal with the anxiety that can provide you some pretty much immediate relief.
Oh, thank goodness.
Things like relaxation techniques. I have a friend, Mark, who is very, very good at leading people and learning how to relax, and that can really help bring the anxiety
I need
down.
something that I can do at work. I can't go relax at work.
You'll be able to do that to a certain extent. Another thing that you can do, and we can work on, is just taking a little mental vacation, going to a happy place in your mind, a place that you've been that you think is very beautiful, that just automatically when you think of that, it relaxes you. And another thing that we can work on is providing you with some positive affirmations, things that are positive that you can tell yourself that can be more productive, such as, I'm good at my job, or I'm a smart guy, anything like that, where you really know down deep that that's true, but sometimes you have to remind yourself of those kinds of things.
Those kinds of thoughts are hard, I think.
Well, we'll work on that.
Okay.
All right. So, do you have any other questions that about our work that we're getting ready to do? Do you have any thoughts that...
So how often do we have to meet together?
Well, I would like for us to meet once a week.
Okay.
And then after we have a certain number of sessions, we'll kind of evaluate that. And the ultimate goal is for you to have the tools that you can go deal with your anxiety on your own.
Okay.
Because that's one benefit of cognitive behavioral therapy. It doesn't have to go on and on and on. It actually can produce some fairly short-term results that I hope that will be happening.
So how many times do you think we need to get together?
At least a dozen, I think.
Right.
And again, let's not limit ourselves with that kind of thing. Let's see how it goes.
Okay.
All right? So can I see you next week at this same time?
Yeah, I'd like to.
And then what we're going to do, among the first things we're going to do, we're going to take a look at that log that you did, where you're identifying those moments that you feel extremely anxious, and kind of look at those situations and see if we can start doing some work on that.
Okay.
All right.
Yeah.
Well, I look forward to working with you, and thanks for being open and sharing with me.
So I just need to write down the times that I'm feeling nervous.
Yeah, and anxious,
Okay.
and other circumstances, things that might be relevant to you feeling that way.
Okay.
All right?
All right. I might have a lot to talk about.
I'm sure you will.
Okay.
All right. Thank you.
Thank you.
Take care.